and welcome back. In this Black Excellist presentation, we will highlight 20 African Americans who have shaped public health and the medical world.
Welcome to blackexcellist.com, the site where we share Black excellence, opulence, and affluence. Our mission is to inspire you as we enlighten you.
The leadership and legacy of African Americans in the arena of medicine and public health often goes unnoticed in mainstream media. As with most of the historical icons or living legends we highlight, the accomplishments of these medical professionals, health experts, and researchers occur within an American system where their African American peers are not offered the benefits and breakthroughs that they helped create. However, we salute these countless individuals who have pioneered in a way that creates a healthier planet for our generation and for those to come. In performing our research, we supplemented our list with the discovery of a list also compiled by Casey Bishopp and Sabra Farquharson of IntraHealth International that highlights the contributions and sacrifices of African Americans in the medical field. This short list is just a small selection of nurses, scholars, health workers, and medical professionals who deserve to be remembered and celebrated. And even in the midst of this COVID-19 pandemic, it's Black excellence to know that African Americans are taking charge in the medical and health establishment to promote us not as victims, but as leaders and problem solvers. In this original Black Excellence video, we will be featuring the 20 public health pioneers. So without further ado, let's get started. Number 1. KIZZMEKIA S. CORBETT, Scientific Lead for Developing a Vaccine for COVID-19. Dr. KIZZMEKIA S. CORBETT, a research fellow and viral immunologist working with the National Institute of Allergy and Infectious Diseases, is the scientific lead for the coronavirus vaccines and immunopathogenesis team at the National Institutes of Health, National Institute of Allergy and Infectious Diseases Vaccine Research Center, VRC. Dr. CORBETT uses her expertise to propel novel vaccine development for pandemic preparedness. Appointed to the VRC in 2014, her work focuses on developing novel coronavirus vaccines, including mRNA-1273, a leading candidate vaccine against the virus that causes COVID-19. Number 2. JOCELYN Elders, first African American female appointed U.S. Surgeon General. JOCELYN Elders earned her medical degree from the University of Arkansas Medical School in Little Rock in 1960. She returned to the university for her residency in 1961, after which she became chief resident responsible for a team of all-white, all-male residents and interns. Arkansas Governor Bill Clinton appointed Dr. Elders director of the Arkansas Department of Health in 1987. As U.S. President, Mr. Clinton appointed Dr. Elders the first Black U.S. Surgeon General in 1993. Number 3. Donna M. Christensen, first female doctor in the U.S. House of Representatives. Donna M. Christensen was the first woman to represent the U.S. Virgin Islands and the first female medical doctor in the House of Representatives. She chaired the Congressional Black Caucus's Health Brain Trust for 15 years, where she worked to address social determinants of health and tackle the HIV/AIDS threat both domestically and internationally. Number 4. HENRIETTA Lacks, presumed consent donor, whose cells led to the development of the polio vaccine. HENRIETTA Lacks was a young mother when she was diagnosed with cervical cancer in 1951. When her cells were biopsied, it was revealed that unlike other samples, which died quickly leaving little time for close examination, Lacks' cells multiplied every 20 to 24 hours. To this day, HeLa cells, named after her, are used to study cancer without experimenting on humans, leading to such advancement as the development of the polio vaccine. Number 5. LOYCE Pace, President and Executive Director of Global Health Council. LOYCE Pace is President and Executive Director of Global Health Council. She is a multilingual policy and advocacy expert who has worked in several countries to further access to essential medicines and establish the Non-Communicable Disease Roundtable through Global Health Council. Number 6. Charles Richard Drew, father of the blood bank. Charles Drew was a pioneer in blood transfusion and the first African American to earn a medical doctorate from Columbia University. His research was instrumental in providing much-needed plasma to soldiers during World War II, and he is known as the father of the blood bank for his innovative mobile blood donation concept. Number 7. Regina Benjamin served as the 18th U.S. Surgeon General. Regina Marcia Benjamin may be best known for her tenure as the 18th U.S. Surgeon General, during which she served as first chair of the National Prevention Council. But it's not just her work at the highest levels of public health that earned her praise. In addition to being appointed the nation's doctor in 2009, Benjamin founded Bayou Clinic in Louisiana, which provides clinical care, social services, and health education to residents of the small Gulf Coast town. Number 8. Alexa Canady, first African-American woman neurosurgeon. Alexa Canady fell in love with the nervous system, and in spite of discouragement from some of those surrounding her, she decided to pursue her passion of becoming a neurosurgeon. Dr. Canady was a pioneer of her time, becoming the first African-American woman neurosurgeon in the United States in 1981. She also made history as the first African-American woman certified a diplomat of the American Board of Neurological Surgery, ABNS. Number 9. ROSELYN EPPS, President of the American Medical Women's Association. ROSELYN EPPS was the first African-American national president of the American Medical Women's Association. She is a dedicated maternal and child health and public health professional who has worked in smoking prevention and cancer research and was Washington, D.C.'s first acting commissioner of public health. Number 10. William Hinton, Harvard University's first African-American professor. William Hinton was a public health pioneer and Harvard University's first Black professor. A microbiologist and bacteriologist, he developed a test for syphilis, later dubbed the Hinton test, which greatly improved the accuracy and reliability of diagnosis of the infection. Number 11. Mary Eliza Mahoney, first African-American licensed nurse. Mary Eliza Mahoney was the first African-American licensed nurse and co-founder of the National Association of Colored Graduate Nurses. Her impeccable professional reputation and dedication to women's rights contribute to her legacy. Number 12. Risa Lavizzo-Mourni. Risa Lavizzo-Mourni was CEO of the Robert Wood Johnson Foundation for nearly 15 years, where she dedicated her tenure to building equity in communities and integrating health systems and services. She currently serves as Professor of Health Policy and Health Equity at the University of Pennsylvania. Number 13. Helene D. Gale, named one of Forbes' 100 Most Powerful Women. Helene D. Gale has been named one of Forbes' 100 Most Powerful Women, and for good reason. As former CEO of CARE USA and during her 20-year tenure at the Centers for Disease Control, she leveraged her global development and humanitarian expertise to further programs on HIV/AIDS. She is the author of many articles on gender equality, social justice, and public health. Number 14. MARILYN Hughes Gaston, first African-American woman to direct a public health service bureau. MARILYN Hughes Gaston was the first African-American woman to direct a public health service bureau in the United States. Her 1986 research led to a sickle cell screening program for newborns, and under her leadership at the Bureau of Primary Health Care in the U.S. Health Resources and Services Administration, her sickle cell research expanded internationally. Number 15. Kenneth Frazier, first African-American to lead a major pharmaceutical company. In 1992, Mr. Frazier joined Merck & Company's Public Affairs Division as General Counsel, helping to define the pharmaceutical giant's legal strategy during the next 10 years. He rose through the management ranks at Merck until he was appointed chairman and CEO in 2011, becoming the first Black man to lead a major pharmaceutical company. Mr. Frazier received his undergraduate degree from the Pennsylvania State University in University Park and earned his law degree from Cambridge, Massachusetts-based Harvard Law School. Number 16. Lonnie Bristow, first African-American president of the American Medical Association. After serving in the U.S. Navy, Dr. Lonnie Bristow became the first African-American president of American Society of Internal Medicine in 1981. Then in 1995, he became the first African-American president of the American Medical Association. His work as president focused on many of the issues he addressed throughout his career, including sickle cell anemia, coronary care, and socioeconomic issues impacting healthcare. One of Bristow's goals as president of the AMA was to address the issue of ethics in the medical community, including implementing ethics courses and questions about ethics on medical licensing exams. He also worked to encourage HIV/AIDS education at home and abroad. Number 17, Jane Wright, first woman elected president of the New York Cancer Society. Jane Wright was a pioneering cancer researcher and accomplished surgeon noted for her contributions to chemotherapy. Her work is largely responsible for elevating chemotherapy from a last-ditch effort at treating cancer patients to a viable treatment option. In particular, Wright is credited with developing the technique of using human tissue culture rather than laboratory mice to test the effects of potential drugs on cancer cells. She also pioneered the use of the drug methotrexate to treat breast cancer and skin cancer. Number 18, Otis Boykin, inventor of 28 electronic devices, including improvements to heart pacemaker. The African-American inventor Otis Boykin patented 28 electronic devices during his career. He developed resistors for electronic components that made the production of televisions and computers much more affordable. But Boykin became best known for improving the pacemaker. The pacemaker uses electrical impulses to help people maintain a regular heartbeat. Boykin came up with a control unit that regulated the pacemaker with more precision. Number 19, Hazel Johnson Brown, first African-American woman promoted to Brigadier General. The first Black woman to be promoted to Brigadier General and the first to head the 7,000-strong U.S. Army Nurse Corps. Hazel W. Johnson Brown was awarded a number of distinguished military decorations, in addition to being named Army Nurse of the Year 2 times. Number 20, Herbert Nickens, first director of DHHS Office of Minority Health. Herbert Nickens graduated from Harvard College in 1969 and went on to receive his MD from the University of Pennsylvania in 1973, concurrently earning a master's degree in sociology. In 1986, Nickens became the first director of the Office of Minority Health at the Department of Health and Human Services. He also developed a program to mentor and promote the careers of minority academic physicians. Nickens wrote passionately about a variety of issues, including minority health status, ethnic and racial diversity in medical education, and access to health care.
We appreciate the fact that you stayed with us until the end. Thank you for spending time with us, and don't forget to like this video. Also, make sure you subscribe so that you never miss a video. Bye for now. We will see you tomorrow.